Hello, and you're watching a TV9 special, Samajhdar Bano, Sehat Ke Ishare Samjho, in collaboration with USV, your reliable healthcare partner, and also Beat Diabetes. And today, viewers, we shine a light on a side of diabetes that often stays hidden: the emotional struggles, the stress, the burnout, and also the quiet signals the mind sends long before the body shows any symptoms. It is an experience millions of Indians live through every single day, yet they rarely talk about it. And to guide us through this important conversation, we are joined by three of India's most respected voices in diabetes care. We have Dr. Aravinda J, one of the country's leading diabetologists, Vice President of the National RSSDI, and also Chairman of Dr. Arvind's Diabetes Center in Bengaluru. His name is trusted across Karnataka for his clinical expertise and compassionate approach. We also have Dr. Mohan Kumar V, Chairman and Managing Director of Molecular Care in Mysuru. He's a pioneer in advanced diagnostics and also research, and has spent years understanding the deeper layers of patient behavior and also long-term disease management. And also joining us is Dr. Ritesh Bansal, a distinguished diabetologist and endocrinology fellow known for his work at the Diabetes Skin and Hair Clinic in Delhi. His strength lies in connecting cutting-edge science with the real emotional needs of the patients, and together they help us understand why emotional well-being is not separate from diabetes care. It is central to it, and today we look at the feelings behind the numbers, the human being behind the condition, and also the hope behind every signal the body and the mind sends us. So let's begin. Dr. Aravinda J, what exactly is diabetes distress? Because this is a very less talked about subject.
Yeah, so the diabetic distress is one of the medical terminology. Actually, it's in the name only. It says it's a distress about the diabetes. We should remember that it is not a depression or it is not a general weakness or anything like that. It's a normal reaction everybody, every person will experience while managing the diabetes. Imagine your emotional fuel tank is running low. That is what it happens. So suddenly you say diabetes, patient becomes very upset and they say, so doctor, I'm feeling very low. I'm getting distress and dejected like that. This is the diabetes distress. But usually what happens is the body sends the signals. The moment the patient has got high sugar, it will tell that persons will experience thirst, tiredness, and there will be a sugar fluctuation. So the mind also sends signals. That is what? Frustration, fear, burnout, and most important is the worrying thing. They start worrying about diabetes, which should not be done. The most good news about diabetes distress is it is highly treatable, and early recognition brings faster relief.
That's right. We just got a sense of what diabetes distress is. Now, Dr. Mohan Kumar, why is diabetes distress so common among Indian masses?
So we all know diabetes is one of the lifestyle diseases which is very, very common. Almost we have around 70 to 80 million diabetic patients in India. Currently, we are world number 2 and we are going to overtake China in the near. That is the reality. And if you look at the care, if you look at the analysis of the data, you can understand 1 in 3 persons can have underlying diabetes distress. Unfortunately, we never look into the emotional health of the patient. Whenever we're talking about diabetics, we only look at what is your HbA1c, lifestyle modification, other things. There is an underlying emotional layer to diabetes which we have to look into. So we talk to the patient, a simple question, how are you feeling? That will elicit a lot of answers. We can connect with the patients. Not only that, when you identify diabetes distress early, it is easily treatable. And at the same time, patient also feels we are with the patient. We have to be emotionally with the patient, apart from being talking about, discussing about diet, lifestyle modification. We have to take care about the emotional aspect of the patient as well. So when you identify early, we can treat in a better way, and the outcome is excellent.
That's right, Dr. Mohan. And coming to you, Dr. Bansal, you know, how does emotional stress affect physical health? Because it's a very, very important subject that people don't often discuss when they're going through it.
So definitely there is a strong connection between the body and the mind. We can't just say they are isolated. One thing affects the other. So if we see mind and body, they are working in a continuum. They are related to each other. So when the patient who is having a distress, who is having stress, their sugar levels might fluctuate more, they might be having more HbA1c. So we definitely need to work on the distress or the stress part, because when we are reducing distress, diabetes distress, the management of diabetes becomes easier. So it is the both the things, that is the mind and the body, they have to work together. They have to work in the harmony so that we can bring down, we can help the patient in the long run.
That's right. And, that was about the emotional distress and how it affects your physical well-being as well. Now, Dr. Aravinda, what are the 4 main emotional pain points? Because this is very, very important as far as, managing your sugar levels are concerned.
Yeah, there are 4 important points is there. First one is the emotional burden. So, moment the patient is have come to know that they are having diabetes, they always feel, why me? Why did I develop? I am tired of it. I feel very bad about it. This is the first thing that anybody will develop. That is what is called as the emotional burden. Second one is the regimen check. Means as a doctor, we ask them to check sugars, and depending upon what the level they have got, we ask them to check it routinely, like once in 10 days, 15 days. If the sugar is well and under control, we ask them to come after 2 months, 3 months also. And most important, next thing we tell about the diet and exercise. People would have not used to that. Means earlier they would have been eating randomly in functions, festivals, and all those things. Moment we say some restriction, they feel very, very bad. And we ask them to do routine exercise, which they are not used to. That also becomes a stress for them. That is called as regimen stress. This is the second point. The third one is the relationship stress. There is some sort of disturbance in the family. There may be some misunderstanding in the family. Oh, this person has got developed diabetes. What to do? We have to do separate food for him. Like this, all these things, parameters will come into the picture. So the family plays an important role in managing any person's diabetes. So this is called as relationship stress. The third one. The fourth one is the doctor-patient stress. Whenever the patient comes to us, we see the patient, we encourage the patient, we motivate the patient to do the proper diet, exercise, and taking medications. If there is a hurry-burry in that, patient becomes distressed as well. Oh, doctors gave me only 2 minutes. I wanted to ask so many questions, and all those things may come. And even when when we are explaining, the patient may also not understand what we are telling. So we always counsel, educate, and do the needful. So these are the 4 areas that affect everyone at some point. So recognizing them is the first step to healing.
That's right, Doctor. And before I take my next question to Dr. Mohan Kumar, we also have our audience who are joining us. And Soumya, an audience who are watching us live right now, is asking, how does fear of complications affect a person's daily emotional state? And how can they break out of that fear cycle, Dr. Aravind?
See, basically, a patient should not worry about the complication. They should always worry about maintaining the present moment, maintaining the present sugar levels. How do they do? So why the fear comes is they would have heard somewhere, some of their friends or relatives, they would have told, oh, that person had diabetes, he developed eye problem, he developed gangrene, he had a heart problem. Like that, they would have heard. So that is why that fear of complications will come. It's not about the fear of complication. It is the motivation what is needed to clear the fear of complication. What is that motivation? To maintain the day-to-day diet, exercise, and proper intake of medications and following doctor's advice.
That's right, Doctor. Now, Dr. Mohan Kumar, when you speak about emotional support, who needs it the most? Is it the youngsters? Is it the middle-aged people? Or is it the vulnerable category that's above 50 years of age?
Yeah, there are a couple of categories where it plays a very, very important role. One is long-standing diabetes with a diabetes duration of more than 10 years. Definitely, they are emotionally drained, stressed. They play a very important role in understanding the emotional well-being of the patient. Apart from that, new onset diabetic, especially in the adolescent age group, lot of emotional distress, why I am affected by this diabetes. These person should also be given emotional support. Apart from that, any patients financially distressed, emotionally, socially backward patients who do not have a support system, they get this particular support system. Definitely it helps in advising better outcome in those patients. So patients with these categories, long-standing diabetes, new onset adolescent diabetics, as well as emotionally and socially backward people, financially distressed people do have a very important system wherein they can get benefit out of this emotional support system which we have to play as a healthcare provider.
Dr. Mohan, teenagers are also affected, and our follow-up question to you is coming in from one of the viewers. His name is Arun, and he's asking that how common is diabetes burnout in teenagers and also young adults, especially with the pressure of school, college, and also social media in today's day and age?
Can you come again, the question?
One of the viewers is asking you, doctor, how common is diabetes burnout in teenagers and also young adults, especially with the pressure of school, college, and even social media?
Yeah, previously, if you look at the data, diabetes in the young was very, means the prevalence or incidence was much lesser. Now, because of the lifestyle, current lifestyle, increased stress factors, not only the junk foods and sedentary lifestyle, addiction to mobile and all, the prevalence of young onset diabetes, especially in the adolescent, we are seeing type 2 diabetes even in the adolescent age group as well, not only type 1 diabetes. So whenever there are diabetics in the younger age group, what is the pressure at this age? Why I got the disease? Number one, when my peers are eating everything, I'm not able to eat the food which I should have been. This is another pressure. So definitely these factors lead to a lot of distress on these youngsters, whether it is adolescents or young adults. Definitely, as healthcare providers, we have a very important role to play in these children, where we can counsel them, talk to them. Once we modify the lifestyle, we can live with the diabetes without much complications because of the availability of current generation of drugs. And of course, we have to emotionally give them support. So definitely, there is a higher level of distress in these children, but with proper healthcare provider assisted support system in terms of emotional stability, definitely these children are benefited.
That's right. And Dr. Bansal, Dr. Mohan Kumar clearly stated that healthcare providers make a clear difference. But how can they really, make a huge difference in one's life, especially of the ones who are affected by diabetes?
So I think that is the most important thing, because we always talk about the as a holistic approach for diabetes. As a practitioner, as a diabetologist, we always maybe write some pills and then tell them to come after some time. That is how we are controlling sugar. But no, a small change in our gesture, small change in our attitude can bring a lot of difference. So first of all, we have to start changing our attitudes, start the way of counseling for the patients. So first is changing the game from blame to maybe empathy. We should be empathic towards the patient, that they are getting diabetes, they are suffering from diabetes, and what are the challenges they are facing. We have to maybe move to their chair. Second, we have to maybe coach the patient rather than maybe ordering the patient. So a shift in that approach will also help the patient. Then maybe we can't give a generalized advice, generalized piece of information to everyone. We have to go for the personalized help. Maybe someone is adult, maybe someone is maybe a young one, as sir has discussed. So a change in our help, a change in our opinion, advice to that particular set of patient can really make a difference. A small change in our advice, small change in our behavior can really help the patient apart from medicines, and that is actually more effective than medicines.
That's right. Baby steps. You take baby steps towards cure and your life will be much more relieved. And to also ask you more questions, we also have Rian joining us live. Dr. Bansal, Rian will ask you a few questions that he has in mind.
Sure. Hi. Hi, Dr. Bansal. So one of my close friends, he's about 23 and he's had diabetes since childhood. So I just want to know how that process works. Like how did he end up, getting it, and what are the precautions that he can take right now or try to reverse it? If you could shed some light on that.
So I assume your friend is already 23 and he has diabetes from childhood. So maybe he might be having type 1 diabetes. See, predominantly or majorly, diabetes fall into two categories. That is the type 1 and type 2. These are the predominantly two categories. And a patient who is having diabetes from the very young age might be type 2 as well, but I think he might be a type 1 diabetic. So definitely, type 1 diabetes per se is because of autoimmune destruction of your body insulins. So in that, you need to replenish the insulin from outside in the form of insulin injections. So apart from that, maybe the treatment for type 1 or type 2 diabetics might differ, but the key principles of diabetes management can't change. Be it type 1, be it type 2, or any other form of diabetes. That is, I always tell the patient that is, you have to follow certain pillars. The first being a good balanced diet. The second being lifestyle modifications in the form of exercise or whatever they can follow. Third is adequate sleep. And fourth, reducing your stress. So we were talking about the stress part. So that is one of the component in management of diabetes. The fifth being drugs or maybe pharmacotherapy, which the doctors give. But those four pillars are really in the hand of the patient, their family members, so that can really make a difference.
That's right, and we hope that Dr. Bansal has answered your question, Ryan. Let me go across to Dr. Aravinda. Doctor, how do people regain control and confidence? Because as soon as they hear about diabetes, they're out of control. They say that, this particular condition is not in our control and they lose confidence. How do they regain control and confidence back after they are, diagnosed of diabetes?
Yeah, so this is the most common things we come across in our day-to-day practice. The moment we say some patient, some person like that, you have developed diabetes, the initial thing is the denial. Doctor, kindly see the report, kindly check the lab reports. It may be wrong, it may be wrongly done, the report may not be correct. I was very strict, and all those things will come. The denial will come. So then our role comes. We always double check or triple check the blood sugar level before we tell the patients. Once we do that, the first thing is they started demotivating. So they become distressed. So we always encourage, motivate. We always tell them, see, you have developed diabetes. That doesn't mean it is the end of the world. It is just the beginning. So it is just the beginning of your life. So I'll always tell them the examples of film actors, film heroes. I'll tell them, so see the hero or see the heroine. They have got enough money, enough power, everything is there, but still they don't eat or don't binge or anything like that. They do it in a moderate way, in a structured way to keep them their body fit and active. In the same way, you have to do. It doesn't mean that you are having a disease itself. It's a more structured, systematic way of keeping your life going ahead. So by telling that, by motivating that, the patient gets encouraged, and we should always keep celebrating their wins. Means, okay, I'll start you on some diet and exercise and start you on a simple medication. You come after 2 or 3 months. Moment they come and their sugar is well controlled, we should start celebrating it. We should start encouraging. We should congratulate. We always congratulate the patient, congratulate the family members also, saying that the reports are good. And we should always take sugar as a data. It's not as a judgment. Oh man, you got 300 sugar, 400 sugar. It's very bad. What you have done? What did you do? We should not talk in the stuff. We should, why this happened? We can bring down to normal. So we always try to build the self-belief step by step to the persons. So another most important thing is asking the patient to do some yoga, meditation, so that he can control his anger, frustration, and reduce your worry. So the main motivation is confidence is to self-educated, self-motivated by the person as well as the doctors, as most important the family members. So all these things, empowerment replaces the helplessness. So that is what I want to say.
That's right. The entire ecosystem plays a very, very important role in helping people regain control and confidence. And also, Dr. Aravinda, we have a viewer named Rakshan who's joining us live on this broadcast to ask you more questions. Yes, Rakshan.
My question to you is that we know that refined sugar or say chocolates or sweets and mithais are things that cause you diabetes or are harmful to you. But what are some natural things that we have in our kitchen that we unknowingly consume on a day-to-day basis that might cause or maybe do cause diabetes to us. You know, like the secret killers,
Yeah,
maybe.
so basically, yeah. So basically, the homemade foods are the safest foods for all the persons. So any homemade foods, if it is consumed under the limited quantity, it is definitely helpful. You imagine your mother who is cooking, your grandmother is cooking the food at home. They are all the rich food, nourished food, and is a good food. So problem lies when you start consuming the outside food like processed and micro-processed, refined food and all those things. These things are, well, that's why we call them as junk foods. So people get easily carried away with this fast food because you order in the social media, you order in the some apps, it will come to in your doorstep within 5 to 10 minutes. So you get easy foods. That those kinds of food, if you see, they are rich in calories, rich in carbohydrates, and rich in fat. These are the things which is not good. You should not think that I ate today 10 gulab jamun. Today, tomorrow I'll develop diabetes. No, it's not like that. It's not definitely not like that because over a period of time, these things happens. Lack of exercise and constant eating of junk food. Nowadays, what happens? I stay in Bangalore. Most of the people, like in IT professional or business, or so they're under constant pressure, stress, and they want to have their food within 5 minutes. Fast foods. So these are the things, and the lack of exercise. They don't do exercise also. So all these things, stress, junk foods, lack of exercise, all these things leads to development of diabetes. It is not like any particular villain at your home, villain food at your home which will cause diabetes. It's your habit which is making the person develop the diabetes.
That's right, and that's very well articulated, Dr. Aravinda. Now, let's go across to the screening phase because, you know, people, when they don't get their symptoms, they believe that they don't have any underlying problems. So, Dr. Mohan Kumar, how does screening really help? Because screening is a very, very important aspect to identify what's really happening with your body.
Yes. So screening plays a very, very important role in identifying diabetes distress. So just like screening for diabetes, whether it is fasting sugars, postprandial sugars, HbA1c, or other lab parameters, we have to discuss with the patient, ask few simple questions to the patient. It is just like a questionnaire. It is very simple, very fast, and very effective. The moment you talk to the patient about his emotional wellness, how he is feeling, we will understand what is the status patient is having. We can understand how much the patient is distressed. Once we understand, it is easier for us to formulate. Apart from pharmacotherapy, we have to counsel the patient regarding the importance of emotional well-being. We have to talk with the patient, spend some time with the patient. That plays a very, very important role. Reassure the patient. Patient gets connected with you. It is not just like any other patient coming to you, oh, take this tablet, take that tablet. It is not like that. We have to talk, discuss, counsel the patient, spend time with the patient. Apart from lifestyle modification, we have to address the issue of emotional health as well. So screening is very, very simple. It is a simple questionnaire. So it hardly takes 2 to 3 questions to understand the emotional well-being of the patient. Once you understand patient is distressed, you can talk to them, talk to the patients perfectly and counsel them so that long-term complications are prevented, like major depression, major depressive disorders, all those things can be prevented.
That's right, Mohan Kumar. And Doctor, we also have a question coming in from our audience. One of them named Dinesh. He speaks about, you know, sudden healthcare spike in sugar levels. How does, how does a person build or rebuild their emotional strength after a sudden health scare, like a sugar spike or hospital admission? After the screening process, he's taken all the steps that's necessary. But if there's a sudden spike in your sugar levels and that prompts hospital admission, how does one rebuild their emotional strength?
So immediately, if there is a spike in the sugars, if it warrants admission, definitely patient needs to be admitted. So once the patient is stabilized, his sugars are stabilized, we have to talk to the patient. What caused the spike of the sugars? Very importantly, is it an infection? Is it something else? what is the reason which caused the spike in the sugar. If it is emotional distress, which is playing a very important role in causing the sugar spike, definitely we have to talk to the patient in terms of counseling, discuss with the patient, so that is whatever reasons are there because for the spike of the sugars, that should be taken care. Only thing is we have to discuss, talk to the patient. If there are other distressing factors, stressful factors, we have to address those parameters, those factors. Then if sugars are taken care pharmacologically, apart from that, if there are psychological aspects, definitely we can sit and talk to the patient. If necessary, we can give them counseling with a psychologist as well.
That's right. And Dr. Ritesh Bansal, we have another viewer, Rajesh, who's joining us on this broadcast. He will take the next question to you. Yes, Rajesh, please go on.
My question is that my mother-in-law is suffering from very high diabetes. So, and she takes insulin every day. So, what are the long-term remedies and to avoid her keep away from the taking insulin every day? So, what are the long-term remedies for diabetes? So, this is my question. So, yeah,
If
can
your
you
mother-in-law has been prescribed insulin, okay. See, if your mother-in-law has been prescribed insulin, then definitely the consulting diabetologist must have seen because of her sugar levels. Maybe she might be having high prandial sugar. She might be having fasting high sugars, despite maybe 2 or 3 oral drugs. So that depends on the patient to patient that if she or they are needing insulin, then we definitely need to do so because insulin is like any other medicine. We can't just maybe because it's a injectable, we can't undermine the importance of insulin in controlling sugars. But the point being, because it's a injectable, we sometimes have to take maybe 2 or 3 injections of insulin every day. That sometimes become a bit tricky. So with the advent of maybe newer drugs, maybe as we are also looking at maybe inhaled insulin, we are also looking at a weekly insulin. Those things might, or maybe the GLP-1 RAs, or maybe sugar can be controlled in a better way without insulin or without the number of those kind of pricks. But still, if your mother is looking for a maybe better home remedy, better long-term remedy, then we can't ignore those 5 pillars. That is eating properly, following a very healthy lifestyle, eating at a proper time and following that 7 to 8 hours of sleep. And we have to control our emotional distress. We can't just maybe the emotional part component cannot overtake our body. So all these things along with your pharmacotherapy helps in controlling the desired or bringing the sugar to the desired limit because ultimately we are looking at the control of complications. If we won't control your sugars in the present, will be looking at a complications in the future. So our ultimate story is to have a better control of sugar with all the components. Some of them might be contributing 10%, some might be contributing 20%, but eventually the number has to be 100%. So we are looking at a zero complications.
That's right, Dr. Bansal, and support from all quarters really matters a lot, especially in helping a person fight against diabetes. So what can families and communities do to help a person in their fight?
That is actually a very important component of the diabetes management because if families are not supporting the patient, they somehow they might not be going with the way the patient we want to go because sometimes there can be a discouragement from the family members. Okay, you are not following a healthy diet, you are not following a healthy habit. That is why you are getting sugar. So we somehow have to stop this blame game. We can't just blame the patient that he or she is getting sugar because of their fault because it's a multifactorial problem. The causes of diabetes are so many that we can't always control those factors. We can, yes, definitely modify some of the factors, but we can't control everything. So the patients, along with their family, they have to be very. They need to encourage the patient. Okay, you have got the disease, but we are with you in the disease. We will help you. So maybe first thing is we have to stop the discouragement of the patient. Second is helping the patient, maybe motivating them. Okay, you have skipped your walk today. Okay, let's go together. So maybe helping the patient in that way. Third is you just can't see the numbers. Your sugar is 200, you're not doing fine. Maybe you have to see the previous data. The patient's overall sugars are okay. The single value is of maybe 200. So we need to encourage the patient rather than going the other way. And believe me, if the patient, family members, the doctors, they support the community, if they support the patient, they can go a long way in the management of diabetes without maybe going for the, or maybe the need of the drugs somehow reduces. So family members, doctors, community, everyone who is around you, who is around a diabetic, and the prevalence being so high, everyone is maybe knowing one or two diabetics. So all the patients, their family members, the community members, they can help the patient in the management of diabetes.
That's right. And Dr. Aravinda, this conversation is very, very important. And also we have more voices joining us. We have Divakar who is joining us on this broadcast. Divakar, we have Dr. Aravinda and two other doctors as well who are specialists in controlling diabetes. Please take your question to Dr. Aravinda.
So my father has been diabetes from last 20 years and he's now to undergo cataract surgery. But a few hospitals are not ready to give us provide a fitness certificate due to his diabetes. Okay. So my question to understand is cataract surgery safe for the long-term diabetes patients, and what is the precautions we take before and after surgery in this case?
So this is the routine discussion always happens between different specialties of medical field. So cataract is one of the commonest things which occurs, which can come to any persons. Like it's not only diabetic patients; it comes to normal persons also as the aging takes place. But in a diabetic patient, cataract can be seen early. The most important, if the person is undergoing cataract or any other surgery for that matter, is the proper control of diabetes. That is the most important thing, because why it is important, because controlling sugar and getting a surgery done avoids unnecessary infection. That is why the other specialty, whether it may be ophthalmology or orthopedics or gynecology, whichever other specialties are there, they want the sugars to be well controlled to avoid the onset of new infection. So because higher the sugar, the higher the chances of infection because of the low immunity. That is the reason controlling sugar is important. So we always, whenever the patient comes for any fitness for surgery, we make sure their sugars are well controlled before we give fitness for the surgery. So even minor cataract is a minor surgery, it's a daycare surgery where there will not be major bleeding or so. So we expect usually the random blood sugar should be at least less than 200 so that we can categorically give fitness for the surgery to take place.
Dr. Aravinda, let's put the focus back on the emotional well-being, because emotional well-being is very, very important for physical well-being. So how does emotional well-being supercharge effective physical management?
So emotional well-being is the most important thing. So moment the patient understands the disease, knows about the disease, reads about the disease, then once you feel comfortable, when he become emotionally active, so that gives a lot of confidence to him. Oh my God, this is okay, I can manage this diabetes. This is not a big thing. The diet and exercise, I'll follow whatever the doctor, the dietitian has advised. I will do this myself. So once that emotional well-being comes into its mind, automatically he starts walking well. He goes to gym. The new year is coming up. I'm sure the enrollment will be more for the gym because of the good motivations. And he starts eating healthy food. He tries to avoid junk foods. All this plays an important role. We always tell as a doctor, I tell them, see man, you have got 24 hours a day. In that, you sleep for 6 to 8 hours. That has to be done compulsorily. So 8 hours is gone. 1 hour is for the restroom activities. 1 hour you should keep it for your exercise, whatever it is done. So 8 plus 1 plus 1. So 9 plus 10. 10 hours it is there. 10 hours you should give it to yourself. That is the need of the hour. Remaining 14 hours you slog. That is not a problem. Whichever the profession you are there, you slog it, no problem. You become busy. You want to earn, you want to progress in life. Yes, you do it, no problem at all. Do the dieting, do the exercise, keep your health active. That is the most important. Health is wealth. We should remember that. If you, no, doctor, I don't get time to do exercise. I don't get time to get good dieting and all. No, you should not tell. What is the point of earning if you are not taking care of your health? So this kind of emotional well-being we take. Moment the person understands this, automatically the physical health improves. By doing this, both physical, mental health, everything is taken place and the diabetic distress comes down.
That's right, Dr. Aravinda. Getting control of your mind is very, very important, because when you step out, you have a lot of distractions. You have street food and you have whatnot. You have sweets that you really want to have, you really desire to have, but controlling these desires will really play a very, very important role. Now, speaking about the mind, Dr. Mohan Kumar, what is the key difference between diabetes distress and also depression that gives us hope?
Yes. So diabetes distress is a condition which is very, very specific to diabetes as such. It is about managing the day-to-day affairs of diabetes, which is giving rise to diabetes distress. When the patient is distressed about diabetes, we have to talk to the patient in terms of how we can take care, because he has to live with diabetes for a next decade or so, or a couple of decades, for a long duration, especially in a young diabetic. So unlike diabetic distress, depression is a simple it is not just simple, it is a major psychiatric disorder. It is a full-blown psychiatric disorder which requires attention of the psychiatrist, long-term counseling apart from medication. If you don't treat the diabetes distress, if you don't identify and treat diabetes distress at the earliest, maybe these patients can go in a long way to become major clinical depressive disorder. So that we can avoid when you talk to the patient, counsel the patient. So it is very simple. You talk to the patient, you have to live with the diabetes, how well you can take care of the diabetes, how well you can take care of your sugars. Just simple modification in lifestyle in terms of regular exercise, a regular amount of sleep, and of course, proper dietary modification and taking the medication in proper, as advised by the consultant. You can take care of the complications as well. So diabetes distress definitely is a different entity when compared to depressive disorder, which is a psychiatric illness.
That's right, Dr. Mohan Kumar. We have a question coming in from one of our viewers named Shankar, and he asks, does loss of sleep play a role in worsening both emotional distress and also sugar levels?
Of course, it plays a very, very important role, not only in terms of dysglycemia or hyperglycemia, it also plays a very important role in terms of emotional health. Because the next day following a distressed sleep or disturbed sleep, next day is going to be very, very troublesome. Not only that, it plays a very, very important role in terms of sugars not being controlled. Not only that, there is a higher risk of cardiovascular morbidity as well as mortality because of long-term disturbed sleep. So sleep plays a very, very important role in terms of management of diabetes. Apart from that, other chronic lifestyle diseases. So sleep is very, very important in terms of its quality of sleep and the duration of sleep.
That's right, because loss of sleep triggers depression. Then if you have diabetes, then it leads to adverse diabetes distress. And in the whole, your health is completely in haywire. So Dr. Ritesh Bansal, my final question to you is, what is the hopeful message that you want to give for India?
Okay, so I think that is the most, I will have to summarize the entire session. So, see, diabetes distress is an early, it is a real common and highly treatable problem or condition. And with the right approach, with the involvement of the family members, with the involvement of the trained, healthcare providers like doctors or maybe dietitians, and maybe a supportive community, we can really target this problem. We can really help the patient in this. And our body also is giving those kind of signals. So we have to act early. We have to listen to those signals that what the body is giving. And maybe if we are acting early in the present, we can definitely shape a better future. So our body, along with the support of the community and with the involvement of their doctors, with the involvement of their physicians, patients can really live a wonderful life and they can be as healthy as a non-diabetic patients.
That's right. And Dr. Aravinda J, Dr. Mohan Kumar and Dr. Bansal, what an interesting conversation that we've had today. Thank you for joining us. And as we come to the end of this special, remember this, viewers, diabetes is not just a medical condition. It's a journey that you walk every single day. Some days feel very easy, some days feel lonely, and some days the mind becomes tired long before the body does. So if you have ever felt worried, frustrated or overwhelmed, you are not weak and you are not alone. You're just human to be feeling that way. And the most important message today is that you do not have to fight this alone. Your family, your community and your healthcare team and conversations like this one are here to walk you through this. And when your mind feels lighter, your health becomes stronger. And when someone truly listens, healing then actually begins. So pay attention to the small signals your body sends, pay attention to the softer signals your heart sends, and most importantly, be kind to yourself on the days that you struggle. You don't have to go hard on yourself. So from all of us here at TV9 in collaboration with USV and also Beat Diabetes, thank you for joining us. Take care of your sugar, take care of your stress and take care of your spirit, because your well-being is not just a number, it is a story worth nurturing every single day. Well, that's all we could pack for our viewers in this special conversation where we shone the light on diabetes distress, how important it is to manage your emotional well-being, because that holds the key to your overall well-being, be it physical, mental or even spiritual well-being. And this is the way forward, as mentioned by 3 of the diabetologists who joined us live on this conversation. Thank you for watching TV9.